Hello everyone, I'm Meena Norona and I'm back with another episode of Walk the Special Path. Today we have a very eminent personality with us. She is a brilliant surgeon and more than that, a beautiful and patient human being. Hello Dr. Joylene.
Hi, Meena.
Welcome to our show. Dr. Joylene Almeida is a gynecologist and laparoscopic surgeon. She is working as associate professor at Father Muller's Medical College, Mangaluru. She is also having a private practice at Pulse Polyclinic, Mangaluru. Her areas of specialization include high-risk pregnancies, adolescent gynecology, and preventive gynecology. She is a co-founder of Moms of Mangalore Group, a community of 37K mothers focused on women's health and empowerment. She is a key member of various women health campaigns and delivers radio and TV talk shows, webinars to promote health and well-being of women and adolescents. She has also published articles and papers in reputed journals. Today it's our pleasure to have her here with us so that we can discuss more about a certain topic which is usually spoken behind doors. Today we break the barriers and we want to speak out loud about this, which is troubling many of the special parents around. We as special parents, we always scared of our children, especially when they are small. But yes, when they grow into adolescent, the fear creeps in more worse than ever. Puberty, the topic which is really taboo, which we don't speak out loud. There are so many questions and fears in parents' mind when it comes to puberty in special needs children. So today we are going to have an open heart talk with Dr. Joylene Almeida, who is going to remove all our fears and speak about these topics with us. Thank you, Dr. Joylene Almeida, being here with us and speaking about this puberty in special needs children. So doctor, today I would like to ask you, what is exactly puberty in child development?
So Meena, thank you for that very kind introduction, and it gives me immense pleasure to be here today. Puberty is actually a phase of transition when a child's body is sort of like morphing or changing into an adult body. And it's a very tricky time for parents and for children. The end result of this child's body changing into an adult body is actually for the function of reproduction or sexual maturation. But what happens in this transition phase that we call puberty or adolescence is that a lot of physical, psychosocial, cognitive and sexual changes are happening in the child's body as well as in the mind. So some people call puberty a time of adjustment. Some people say it could be a matter of pride that a child has undergone puberty. For some people, it's actually a matter of embarrassment. And in case of a special needs child, puberty actually becomes a time which is a testing time for the parent and the child as well. Now, during puberty, the changes that we talk about when we say physical, essentially the body is changing, and we know that in girls there's breast development and other changes, and in the boys of course there's scrotal enlargement, testicle enlargement and things like that. Also, more importantly, what really bothers a special need child and a parent are the psychosocial changes that happen at the time of puberty. So puberty is essentially a time of transition.
Okay, thank you, doctor. I think puberty is a topic which we always fear, especially when it comes to a special needs child or an adolescent. It's really a very fearsome period in the child's as well as the parents' life, because it's very difficult to communicate to the children when they are non-verbal and to understand their pains, worries, or whatever is going on between them. So doctor, what are the common issues during the puberty in special needs children?
So essentially, before actually getting into the problems of a special need child, what happens on the parents' front is, very often a special need parent thinks that even if I were to explain or were to prepare my child about the changes that happen in puberty, the child may not be able to understand, which is something that we should sort of like not focus on. We should not assume or underestimate our children. Even if it's a special needs child, there is a certain level of understanding that the child could actually have. The common issues that we see in special needs children in puberty are essentially physical as well as psychosocial. Now, in the physical changes, what basically happens is the child's body is growing. Suddenly, in girls, of course, there's breast enlargement. their menstrual periods, and along with these menstrual period can come heavy menstrual bleeding, which can happen even in a neurotypical child and more so in a special child. So we see a lot of special children who come with heavy bleeding or irregular periods happening too frequently, and it becomes a matter of inconvenience because the child is not able to understand and the parent is not able to cope with it. Another thing that can happen is PMS. So it has been seen that premenstrual symptoms actually happen a lot more in children who are autistic or in the spectrum or a special needs child. So in girls, this problem of PMS that actually happens in neurotypical kids also in adolescence happens much worse in a special needs child, and that's something that a parent needs to be aware of. So in the physical changes, problems like acne, heavy menstrual bleeding, irregular periods, and also things like PMS can happen. The bigger problem during puberty in a special needs child involves the psychosocial element. So very often we think that because it's a special needs child, they may not face the issues that a neurotypical child is facing at the time of puberty, but that's not what happens. Even a special needs child at the time of puberty faces issues like first is body image. So the body is changing and suddenly a child's body is growing up into adult body. There is breast development in case of girls, in boys there's scrotal enlargement, testicular enlargement, and things are happening, and suddenly the child is wondering somewhere that am I normal? Why is this happening to me? And why are all these changes happening? And it's so difficult for that kid to actually understand. So first is a body image issue that happens at the time of puberty in a special needs child. Peer pressure. So although we think that a special needs child may not really be affected by their friends or people they are when they're at school or where they study, it affects them. So peer pressure is another, or peer problems is a pressure. So when they sort of like observe another child who's in their circle or in their space, and that child is, maybe looking a little different to what they are, or they feel that, their skin is changing or their face is changing, their appearance. So they do look in the mirror, they look at the way they'll appear, and they, appreciate themselves. So peer pressure even happens in a special needs child as well. So body image issues. Another thing that happens specifically in puberty in a special needs child is parental dependence. So puberty is a time when a dependent child is now trying to move in or morph into becoming an independent adult. And for a special needs child where they are so dependent on their parents emotionally as well as physically, moving on from this state of dependence to independence, it becomes very, very tricky. So for a special needs child, suddenly I'm growing and my physiology is saying that I have to become independent, but I'm not able to do it. I'm not able to understand what's happening to me. I'm not able to physically take care of myself. So this problem of dependence on parents is seen specifically in puberty in special needs children. Another thing is about hygiene. So we know that with menstruation in girls and also in boys, you have things like something called as night falls, where boys have these kind of sudden ejaculations in their sleep, which is also called as wet dreams. They call as night falls or wet dreams, which happen very sort of like unprovoked. So in the middle of the night they have a slight ejaculation and they start bedwetting. So this is called as nightfall. So this happens in boys. Another thing is also sudden erections, which can happen even in public places. So these situations where the child is having certain issues where they are bedwetting, or in girls where they are menstruating and they have irregular periods, maintaining hygiene becomes a very, very important issue for special needs children. So this can happen, and hygiene can be maintained only if the parents are aware that these problems are there. They can prepare themselves for these problems. So body image issues, peer issues, problems like heavy menstrual bleeding, menstruation problems, dependence on their parents and dependence issues, and as well as problems with hygiene. And lastly and not the least is about the problems of sexual arousal or sexual attraction, which happen in neurotypical kids, in kids who are special needs. These concepts of sexual attraction, sexual arousal do happen, but it's so difficult to explain and for them to understand that a lot of parental understanding and parental interest is required for the parent to know that these things are physiological. It can normally happen. It's a part of a normal body.
A lot of guidance is necessary.
Yes, where the kid is going through some kind of sexual arousal and sexual attraction, which is not in that child's control. So not being in denial from the parent's part is really required. And these are the common problems that a special needs child can have during puberty.
I think hygiene among them is the most important, it's very
and it's the most challenging for the parents as well.
And parents' work increases, I feel, during this time.
True.
So, doctor, puberty in any child's life, especially a special needs child, why is it so important, and how does it affect the child's development? Because in normal children we can always see it, the physical, emotional changes, but in a special needs child it's very difficult to understand. So how does it affect a child's development?
So, in this development, of course, we mainly talk about the physical development and, like I said, psychosocial. Cognition is something that has a very important perspective in children. So, Meena, when we say cognitive development, we mean thinking and reasoning. Okay? And in an ideal, in a neurotypical child, a regular child, this concept of reasoning and understanding and thinking comes at 2 points in life. One is between 6 to 12 years of age, and then at 12 to 14 years of age. So suddenly there's a cognitive spurt. The child is like a child, very childlike thinking, very playful, and suddenly between 6 to 12 years there's a sudden reasoning and understanding. Why is this happening to my body? And am I normal? And why are these changes happening? Sudden reasoning and thinking that happens between 6 to 12 years and 12 to 14 years. Both are pubertal spurts. So the reason this is very important is because when the changes are happening in the body, it's important for the mind to accept these changes and know that these changes are normal. Okay, and like I said earlier, as it happens in a neurotypical child, in a special needs child, cognitive development sometimes is a little on the back seat. It's not as at par as with a regular child. So in a special needs child, a parent has to give that specific attention to this concept of cognition. And like I said, from experience, what I have seen is a lot of special need parents tend to underestimate their children. They even before trying, they probably and of course it's a battle that only they find, only they can
Yes,
understand.
true, very true, yes.
And a special need child, like I always say, is a special parent that God has chosen, because what they do, it's not at all possible for everyone else to do, or a neurotypical parent to do. But at the same time, sometimes because of issues in life and how things have gone on with that child, and maybe because of some kind of disappointment and being upset, they tend to underestimate their children a lot. So the strategy that they use to make their child understand puberty and go through puberty has to change, and for that they would need a lot of help, guidance, a lot of knowledge and preparation on their side. So most often what happens is these cognitive changes happen, the child starts reasoning and understanding, but the parent feels that my child may not be able to understand, and that itself becomes like a step at the back. So the major thing that happens at that time, like I said, is physical, where the body is changing; psychosocial, where the child starts wondering about, what's happening to me, and will I be accepted, why am I looking so weird in the mirror, and peer pressure. And also things about depending on their parents, again, like I said, hygiene, and more importantly, cognition, which would mean understanding or reasoning, which is not in a special child as much as it is in a neurotypical child. So a special child requires that much more assistance with
But I think
cognition.
sometimes these special children are more smarter than we give them credit for.
Yes, exactly.
They
We tend to
understand things,
underestimate
yeah.
them, and even the EQ, the emotional quotient, is so much more with them than probably in
I
neurotypical
think they
children.
need a lot of support at that time.
Yes,
It's more
very,
of,
very much.
So I think most of the changes will be emotional during the puberty in special needs children. So how can a parent or a caregiver or teachers or people around him, how they can support, especially what are these emotional changes in puberty and how we can support them?
So like I said, emotional changes in puberty mainly revolve around body image, and even special needs children have body image issues where they feel, oh, I'm looking really fat, and someone's looking really thin, skin color, appearance of hair on the face, hoarseness of the voice. All these body image issues happen in special needs children as well. Now for a parent, for a teacher, for a caregiver, it's very, very important for us to prepare. So we know that we have a child who's approaching that 9 or 10 years of age and sort of like going towards puberty. We have to start preparing. We have to start preparing for that time when that child is going to be between 9 to 14 and suddenly have that development. So like I said, in a special needs child, when puberty starts, in girls, it starts with breast development, which is called as tilak. So once the breast part starts developing, 2 to 3 years later, the child is going to have a menstruation or a menarche. That's the general principle. Of course, development depends upon genetics. It also depends on physical activity. So if you have a special needs child who's not moving around too much, a little on the sitting side, they're going to have a little delay or an early puberty as compared to a special needs child who's very active and
So
who
it's
moves
better
around
to
a
keep
lot.
them active.
Very much. So these changes depend on genetics as well as on physical activity. Now for a parent, be aware. First of all, read, probably, listen, and you have wonderful people like you who are doing a lot of awareness programs to help special need parents. So use resources to start preparing yourself, because just like battle, or any problem in life, if you're prepared, it gives you a lot of inner strength to face that problem as well. So it's going to be tough, it's not going to be easy, and it's going to, you're going to have a lot of things in your face, or a lot of moments when you think, why is it me, why am I in this situation? But the only and the biggest solution to this is to prepare. So you know your child is approaching that 8 or 9 years of age, start reading, start preparing yourself for that time, and start understanding puberty before you actually try to explain it to your child. So understanding is very important. So the first thing for caregivers and parents is start preparing. The second important thing is try not to be judgmental. So try not to, sometimes it becomes very difficult, because even if it's a special needs child, it's our child. And it's like,
True.
why, how can my child be like this? It's always a question that probably, by paternal instinct it comes into parental instinct it comes into our mind. So don't be judgmental. Don't try to sort of like put your opinions or your, mindset into the child. Listen and be open to questions. If your child is asking you a question, or your child is trying to listen to what, give time to what the child has to say, or understand what the child feels.
I think in our society we compare a lot.
Yeah, that's very a thing that should never be done, comparing and being judgmental. Another thing, with parents, especially parents of girls, that I have noticed, and a lot even with neurotypical parents, not just the special needs, is that if you've had, as a parent, have had a negative experience with menstruation, let's say you had very bad period cramps, or you had a very messy period, or irregular periods, don't let your negative emotions fall onto your child.
Yes.
Whatever happens for a special needs child, a pubertal experience has to be positive, and that should be your only goal. You have to make them realize that it's normal, it's happening because it happens to everybody, and it is not negative. It has to be positive. Even if you've had a negative experience in your life, with puberty, with menstruation, with everything else, never let your negative emotions come onto your child. And that's the biggest thing that you can do for your child when you're preparing them for puberty. So one is, of course, prepare yourself, don't be judgmental. Third is, don't let your emotions or your negative experiences fall onto your child. And lastly, whenever you encounter a problem, let's say you have a special needs child who suddenly had a period and is not cooperating with you to maintain hygiene, or you're in a place, or let's say it's a boy, and a special needs boy who suddenly has an unexplained erection in a public place, or has had a nightfall in a public place. It's a situation that you probably as a parent will not be able to handle. But in that case, what we can do is, rather than try to fix the individual, and never try to think that you're going to fix your special needs child, because your child is special and doesn't need to be fixed.
Yes.
Your child needs to be accommodated or adjusted into our environment. So try to change the environment rather than change the child. That's like a big a thing or a concept that a special child parent should get into their mind. So don't change the child, or don't try to fix the child and say, I'm going to correct her or I'm going to fix her. No, your issue should be, you try to train the child to become independent. At the same time, try to change the environment. So for example, child is in a position where she's had a messy period, or she's messed herself up. Probably the next time, make sure that wherever the child is, in a school or in a setting where she's learning something, there is a backup. There is something like a menstrual kit, or a room where a special needs child can go and change, or a spare change of clothes that is kept in that environment. So try to adjust the environment so that the child doesn't feel like, okay, something abnormal or bad has happened to them.
True.
Similarly, in case of boys, so they have these probably in the West, they have this concept where they train special children. They have certain privacy corners, they call them. So personal corners or privacy corners, where if the child or a special needs boy has a certain sort of like an erection or an ejaculation in public, where he's not able to control, they take him to that personal corner or their safety corner, and the child knows that I can go there and this is going to happen, and I'm going to clean myself and maintain hygiene. So very important, change the mind and change the environment, and not go on to like fixing the child or correcting the child.
I think that we need in India,
Very much so.
especially in Mangaluru, where I have heard of, girls are sent home with the period pad, used pad packed in the bags. I think they need to be more careful about hygiene and having a kit like that. These all need to be taught to all these schools. I think they should practice more. Otherwise, very difficult with the special needs children, I think, ma'am. So, ma'am, I think during puberty, usually normal children face all type of changes. So, in special needs, exactly, what are the social changes or physical you explain? So, how emotionally they will change, or mainly is the social, because now we live in a society. What are these changes we can expect in these children?
So, Meena, essentially when we say special needs, and we all know it's either intellectual disability or developmental disability. So, intellectual disability is, it starts from dyslexia and everything else, like autism and kids in the spectrum, etc. And then you have developmental disability in children where they're physically not able to handle. So, both these categories of special needs children usually have problems with puberty and have problems with adjusting. Now, why are we trying to train our special needs children with puberty? The primary reason why we're trying to train them is for two. One is we want to make them as independent as possible.
Yes,
as they grow,
true.
we don't want them to feel when they hit puberty, when they go into their menstruation, we don't want them to feel that we are dependent and we don't know what to do, we're lost. So, to create a sense of independence in that intellectually disabled or developmentally disabled child as much as possible. Okay. As much as possible, try to make them independent. The second thing is to keep them safe, to safeguard their the personal space, basically to prevent things like bad touch, good touch, prevent things like physical assault or sexual assault, which happens a lot to special needs children who are not under supervision. So, these are the reasons why we are training these kids, and these are the main problems. One is the problem of dependence. The second is the problem of not being really safe in an environment where people around you are not aware, and there may be people who want to take advantage of a special needs child in an abnormal way. So, training our kids with these two goals in mind. One is a question of independence, how to be independent, maintain hygiene, know that this is normal and it's going to be manageable, you're going to be able to handle this. The second thing is the concept of course, maintaining your
safety is very
safety is important. So, your body parts, like what places are not allowed to be touched. The concept of good touch and bad touch.
I think it's very difficult to explain to a special needs
kid,
but we can.
But there are different methods of doing this, Meena, and they say that, like I said, one is we shouldn't underestimate our kids. We have to work around a way in which we can explain to them. So, a simple technique what they suggest is like when you're giving a wash to the kid, or when you're bathing them, start naming the body parts as they are. So, use the body part names as they are. So, don't use anything which is like a sort of like a nickname kind of thing. So, name the body parts as they are. And every time you teach your kid, you have to reinforce. So, in the special needs child, the concept of reinforcement is very important. You have to keep on telling them that these are your body parts, nobody is allowed to touch them, and it's changing, you're growing up, and it's a very normal thing, and it's a very positive thing, you're growing up, and you have to keep teaching them and reinforcing them. Some strategies are, you could use things like, use books, or use visual cues where you make sort of these pictures and stick them with Velcro.
Even I think on you can show them on tabs and all.
On tabs, yeah. So, using technology, learners, which we have very much to our access now, using technology in training our special needs kids, ideally start with things like naming the body parts and then gradually progressing to you're changing, it's normal and things are going on, you're growing up, you're becoming big. So, move on to something like that, and then use visual cues, like use the pictures and say, and then also say things like when do you say no? If someone touches you here, you say no, and if this happens, for example, if you say things, simple things like you're passing urine, you're passing stools, some time of the month you may pass a little bit of blood, which again, of course, again it depends on the understanding of the child and the level of intellectual disability. But most often, if there is a way that you can break through to the kid, which the parent or the teacher knows, and more than anybody else. So, you break through to them and you tell them that this bleeding is going to happen, and it's nothing to be scared about, nothing to worry about, and it's a part of your normal growth. And then you take it from there. You use the visual cues, use books, very important. And you would know, Meena, like for special needs children, as you've been taking sessions, always you know that maintaining a schedule is very important.
True.
For them, that schedule is important in children always. In special needs, we have to maintain that schedule. We have to teach and reinforce. Keep teaching, reinforcing, and frequently use the cues till that concept actually enters into their system and they absorb it and they say that, okay, this is happening to me and it's been happening every day. So, I think it must be normal. And my mother or my teacher seems very happy or positive about it. So, it may not be something that is worrisome. And they pick up those emotional cues as much as they can.
What you have told, it's very correct, ma'am. I think not only parents but in schools this is all missing. I think we should include it in the schools, the syllabus of the special needs child, because we have seen here in Mangaluru schools and all, this is very much lacking. I think it is a partnership between parents, teachers, where we can teach these children all these things. Especially, I think what you said was a point, learn to say no when touching, all these bad touches, good touch. I think these are very important lessons to be taught to a special needs child.
So, we have this concept of the swimsuit. So ideally, if you put the child in a swimsuit, those are the areas of the body that people are not allowed to touch, and other than of course your parent, and nobody allowed. So you teach them those concepts. Sometimes what we do is we keep a teddy bear and we put a kind of like a cloth on. We mark the areas and we say that this you're not supposed to allow anyone to touch you here, and then relate to the teddy bear as someone who you are. So small things like this, very rightly that you said, with awareness in schools and among people, that special needs is a very special category of children who need that extra care and attention. Once this awareness comes, there will be the concept of where in special schools you have personal spaces created, you have a hygiene corner created where a child who's having, like I said, night falls or menstruation goes and knows how to clean herself and keep themselves clean, understands that the moment this happens, I have to keep myself clean, and it comes in tandem with each other. So creating hygiene kits. So creating a kit where if a child has menstruation, she knows or he knows that I go to my, she says I go to my hygiene kit, I open it and I put in a sanitary pad because I know that it's going to get messy for the next 2-3 days. So, and if I have a little bit of tummy pain, discomfort, I tell it to my parents. So these things are going to come into concept only once awareness is created, and very rightly, like what you said, it's required in special schools, it's required in places where special children are being handled to have these hygiene kits and have hygiene corners for them.
Okay, thank you, ma'am. Ma'am, like now we spoke about emotional changes, social changes, physical. So how does this puberty affect the cognitive development in special needs children?
So again, they say, and the books and literature and studies say that the emotions and the cognitive changes that happen in puberty are very overwhelming for children. Although we've obviously forgotten it because it's been long since we've attained puberty, but in neurotypical and in special needs children, it's very, very overwhelming. This whole emotional thing, the emotions are running very fast, and there's confusion, there's anger, and then there's a little bit of being upset as to why am I changing. You're a child and you're playing with everybody, you're just playing, and suddenly one day you're becoming more aware of yourself. You're like, I'm a girl, I'm not a child anymore, but I'm a girl, or I'm a boy, and that the other person is a boy or a girl themselves. So that awareness starts coming in, and again, like I said, the body starts changing and it becomes a little difficult to accept. But studies have shown that in special needs children and children with autism or kids who are in the spectrum, these emotions come even more in force. They are much more stronger in special needs children. The cognition or the emotional changes are much more in special needs children than in regular children. So understanding and reasoning again becomes an issue, and having to, ideally we shouldn't really classify our children based on IQ or based on what they understand, but this is one concept. Understanding puberty and explaining puberty to a child is a concept wherein the IQ actually comes into play. So based on how much of understanding the child has, you're going to break through to that child and make them understand. So a child who has a decent amount of an IQ, who will be able to understand concept, you start explaining about puberty, you start telling them about the body. But a child who's probably not going to understand other than just parts of the body, you're going to start saying, start showing them and repeatedly pointing out to different parts of the body and saying that this is going to change, this is what's going to happen, and continuously repeating and reinforcing. Okay. So the changes, the cognitive and the social changes happen much more in a special needs child. A special need parent needs to be aware of this, needs to have a lot of patience. Special parents have a lot of patience. They are a gifted lot. That God has sent.
These children bring in more patience.
Very much. So they are resilient, and they're a special category of parents that have an undue amount of patience, and over a period of time it is created in them. It's not that they're born with them, but they fight it out, and they sort of like create that resilience and that hardness in them for the sake of their child, and they're going to require a lot of patience while preparing for puberty as well.
Among what you said, I think this should be a part of the IEP programs in each child's. Like what you said, cognitive changes, all these changes, study of this, how to keep them ready, should be made a part of the IEP program of each special needs child. Then only it will be more helpful.
Very, very much. Another thing that I wanted to tell you, Meena, is before we start about puberty in children and how to explain to parents, this concept of puberty and menstrual hygiene, menstruation, normal changes, sexual arousal, sexual attraction happening in young children has to be understood by parents. So there is a very, very good proportion of parents who don't themselves understand that puberty is normal.
And they are not ready to accept this is going to happen in their special child. They are in denial mode.
They are embarrassed.
Embarrassed,
or they're upset, or they're, why is it happening to me? How can it happen to my child? They're in a denial mode. So, and I'm not talking about just special needs children, it happens a lot of neurotypical children as well. Parents themselves don't understand the concept of puberty, don't understand that, and like I said, normally what happens is, among boys and girls, generally physiologically, among boys, the sexual arousal center is much larger. By nature, it is much larger. So, although in girls at the time of puberty, this problem of sexual attraction or arousal by just seeing the opposite sex doesn't happen that much or can be controlled. In boys, it sometimes becomes a little uncontrollable. You cannot control that problem of sexual arousal that a special needs child or boy would have when they saw a girl or person of the opposite sex. So this concept that it is actually a proper physiological thing that's happening, that you have to do a lot of behavioral therapy and sort of like streamline this concept of has to be understood by parents first. First, as parents, we have to understand what puberty is, and then think about what we're going to do for a special needs child.
Okay, ma'am. Like we know, in normal children, particular age is there for starting of puberty. In special needs children also, what age, around what age approximate do girls or boys start puberty?
So in a special needs child, the age actually doesn't differ much. So for girls, it is anywhere between 8 to 14 years of age, and for boys, it is anywhere between 9 to 14 years of age. So puberty sort of like sets in a little later in boys, and that happens in special needs children as well. Now, like I mentioned earlier, the age of puberty can differ based on genetics. So if the father or the mother has attained puberty a little early, that child is going to attain puberty early. So it depends upon genetics, it depends on physical activity and nutrition. So there have been studies that have said a lot of meat consumption, lot of excessive dairy consumption can cause early breast development and early menarche in girls. So puberty can come a little early. So your food intake also matters, physical activity. So it's very important as a part of the behavioral therapy that we do in special needs children to keep them very physically active, along with the other things that we do, maintain hygiene, maintain a schedule, keep on reinforcing them while teaching them. It's important to make sure that they sort of like maintain their body weight and keep themselves as physically active. It has been seen that a special needs child who is physically active handles the changes of puberty much better than a child who is physically inactive. So physical activity really helps.
Okay, ma'am. Now, ma'am, how can parents or caregivers give special attention or take care of the special needs child during puberty? You explained some things, but how exactly they can prepare themselves or prepare their child or handle them during the time of puberty?
So firstly, like I said, you have to start preparing well in advance, start preparing before the time actually comes in, and understand that it's like I said again, repeating myself, that you don't fix the child. We cannot fix the child, and there's no concept of fixing, because it's a beautiful human being who's a little different from what neurotypical kids are, but it doesn't mean that the child needs to be fixed. So and a lot of Indian parents have to get this concept into their head, even regular parents are behind sort of like fixing their children.
They want a cure, they want
and they have like a roadmap of a child, and they want their child to fit into that, into that entire diagram of a child.
More of the society acceptance they are looking for.
So it's important while preparing your child for puberty to come with a mental state that I'm going to listen, I'm going to accept. So I call it the ABCs of handling a special needs child. First is accepting. So accept the situation. I have a special needs child, I have a mission in my hand, and I have to take care of this pubertal changes. I'm going to accept my child the way my child is. If my child is having excessive night falls, I'm not going to get upset and think how can it happen or start judging him. I'm going to understand that this is a physiology. It is normal for my child to have a sudden ejaculation in the night, bedwetting in the night, and I'm going to handle it because I'm prepared to handle this. So first thing is accepting. It's called the A, that is accepting and assisting. So don't go all your way and do everything for your child, and make the child understand that you have to come half the way and I'm going to help you. So we have to maintain hygiene, we have to maintain cleanliness, and you're going to do it and I'm going to assist you. So the first A is accepting and assisting. The second is B. B is be there for your child. So more than sort of like be a father figure or a mother figure who says do this, and you're like, it's like you're training your pet or an animal. Don't do that. Be with your child and be there while the child is going through this. Sometimes emotional outbursts are a lot, and because of these mental changes that happen, especially in boys, suddenly emotional outbursts, anger, temper tantrums are a lot in puberty. and becomes a little difficult for parents to handle. It's important to maintain your patience as well as be there for your child at that moment and say that, keep repeating it and saying it's okay, it's going to be fine, I know what you're going through and we're going to go through this together. So it's not that I'm going to watch you when you're going through it, I'm going to be with you through this process. So be there for your child. The third is C. And C stands for create and communicate. So as a part of your puberty preparing or building exercises, start creating things with your child. So be with your child and start creating things. For example, you can just have a simple chart where you're sticking out the body parts and you're explaining at a young age the body part is like this and now it has grown up to this. You're labeling the body parts, you're naming it, and then you're slowly moving on to good touch and bad touch. So create an environment and do a creative activity with your child so that the child feels that bond and that connection with you. And the last C is communicate. So it's very often seen between parents and children that only if the parent expresses or communicates will the child understand the importance of communicating. Now, why are we communicating and what are we communicating? We're communicating I love you. We're communicating that I'm your parent and I'm always there for you. We're communicating that it's okay to be scared, it's okay to be upset, and there's nothing abnormal about it, and whatever happens, I'm there for you. So communicating and vocalizing it, saying it physically and vocally is very important. Why are we communicating? As a special need parent, we're communicating because one, we want our child to know that communication is important. And you can come and tell me anything at any time and I'm not going to judge you. You can scream and have an outburst in front of me and I'm going to be there for you. That's the first reason. The second reason we communicate is because we want our child to understand that when they're not safe or when they have been physically or mentally harassed by somebody, it's abnormal and they're going to communicate that to us. So unless my child knows that this touch is bad or certain parts of the body are not to be touched, the child is not going to come back and tell me. So running that circle of saying that if you're touched here or somebody does this to you, you're going to come back and communicate that to me becomes very important. So very, very simply, and I sort of like even repeat this to myself every day, even with my children. When I think that am I being a good parent, I sort of like say, okay, have I gone through the ABCs? So the first A is accepting and assisting. The second is being there for your child. And third is creating something and communicating with your child as much as possible. And I don't see any reason why this doesn't work with a special needs child most of the time.
That's a very unique way of saying, like, I think all the parents, especially the special parents, need to know this new ABCs. Even I am very enlightened by this. So something unique and something different.
All the things may not work for everybody. It depends on child to child. Yeah, depends on parent to parent. But it's actually a start. Once you start, you will develop your own method, and it just goes in from there.
But this is a new way, like unique way of trying all these things. I hope many parents will try this out. Even I will do that. And I think it's a very nice way to remember also ABCs. So we can remember all this. We can communicate, assess the child. I think being there is very much important for our children. So, doctor, again, leaving these aside, what other problems will parents encounter maybe when they are going out or like we are going to another place for a trip or anywhere? So, what are the problems parents will encounter and how they will find a solution? See, if we want to travel somewhere, the children are going through puberty, so it's a more tough time. So, how we can keep themselves ready, the parents as well as the children during this puberty time?
So traveling always becomes an issue, especially with special needs children. You have to always be prepared for everything. Different things that you have to prepare for while you're handling a special needs child or traveling with a special needs child. One, of course, is emotional outbursts. So sometimes temper tantrum, and like I said, puberty is full of emotions. It's a very overwhelming time, and more so in a special needs child. The emotions come in full force. So be prepared for those emotional outbursts. It's going to happen. The child is going to throw a tantrum and you have to sort of like make your heart and your mind so strong that you're going to go through it. Develop a mechanism where when your child has an emotional outburst, she knows or he knows that they have to come to you and they know that you're going to be their sort of like cushion and say it's going to be okay, and you have a mechanism in which you calm them down. It could be breathing exercises that you have done a drill at home. So try it if you're planning a travel or a trip, maybe start a drill a couple of months prior where you know that if this happens on the trip, this is what we're going to do. So start a drill or sort of like a reinforcement mechanism where you tell the child that now you're upset and this is what we're going to do. We're going to hug each other, or we're going to breathe and do breathing exercises, and we're not going to scream, and we're going to do those things. So Again, there is no substitute for preparation, Meena. It requires a lot of preparation and patience and resilience. So a couple of months before doing these drills and preparing for the emotional outburst, in terms of things like menstruation, where girls can have a messy menstruation or a lot of pain during menstruation, keeping things like a menstruation kit, keeping a sanitary napkin, training the child prior hand that when the period happens, this can be done. Sometimes what we do is, if a child has to travel, we sort of like put on medications or hormone medications to postpone the menstruation, like what most of us do.
That can be done in special needs child also?
Yes, very much. But of course we try to avoid it, because as we know, when we give hormone medications, it messes up with our system a lot sometimes, and we don't want to add that to the child's problem. So we avoid it. It's not a recommended method, but depends on how, if the child is having very painful periods, then we can suppress menstruation for some time, so they can at least enjoy that trip, and for the parents and the child. So medications can be definitely done. In boys, also for things like night falls or bedwetting, maintaining hygiene, understanding, making the child understand that this is okay, don't have to be embarrassed by bedwetting, and we're going to sort of like develop a hygiene mechanism. You're going to clean yourself, wash yourself, change your clothes, and maintain that.
Hygiene is very important.
Very important during travel. During travel becomes extremely important, and again comes only with preparation, anticipating that this problem can happen. So that's another thing, you have to prepare yourself, anticipate it, and then do your drill with your child and reinforce and teach them. Teach them as frequently as you can that this is what's going to happen.
I think with normal children, it's one, twice here, 100 times maybe.
Very much. Repetition is absolutely required, and you'll be surprised to see how actually they are quite intelligent. So
yes,
like I said, and I said again, we sort of like underestimate them at times because of our preconceived notions, but they are very intelligent. They will pick up these emotional and visual cues.
True, very true. Now, despite all these things, now parent is doing a lot of things. We are trying to keep the child prepared. Hygiene is important. The teachers we asking to be a partner. But as Mangalore, as an inclusive community, I think it's still very far. So in this area, like a child, anywhere you go, if anything happens, how can you see Mangalore as an inclusive community in this regard?
So honestly, and like
the society or friends or anybody around, because it's you can't say it, compared to other countries, we are still lagging behind, and we want Mangalore to become a very inclusive society.
So just like with your observation, Mangalore has a long way to go in terms of inclusivity for our special needs children, because there is still an idea where if a special needs child or a parent is walking across or is entering a room or is climbing into a bus, there is no concept of let's help them out. It's just a concept of it's another person walking on the stands, and it's just look at them and just say what you feel. So it's not like they are a special category of people who we have to sort of like accommodate. Let's adjust for them. Let's make a friendly environment for them. That concept has not yet creeped into our into Mangalore as a society. It's coming. We have a lot of special parents and a lot of people who are trying to create awareness, just like you, in the sense who are trying to like incorporate a lot of these things into many parents. So it's growing, but it still has a long way to go. If you compare them to a lot of bigger cities like Bangalore and Bombay, where it's not unusual to have a special needs parent or a special needs child walk into your to climb into a bus or walk into your room and feel normal, feel as it's just like somebody being dark skinned or light skinned, which shouldn't really matter, and being a special need parent or a child shouldn't really matter. So it is going on. There are people who are doing things, but it's going to take a bit of time, and it's still evolving, and it requires a lot of.
I think in that point, I just want to point out that in Mangalore we don't have disabled toilets, like where handicapped, okay, it means only wheelchair. So we need during this time, I think disabled toilets are the need of the hour.
So that again comes from the lack of awareness. So people don't. I mean, if you're a disabled child, then why would you want to travel? You should stay at home. So why would you need
people say.
But which is completely unacceptable, because a special needs child has the right to life as much as a regular child does.
Going to a mall becomes a struggle during these times, because you don't have a disabled toilet there or separate, for them, and
like a hygiene corner,
Nothing is there. So
and why wouldn't you want to take a special needs child to a mall? Why wouldn't you want to take them? Why wouldn't they want to be there to a park? Why wouldn't they want to be there and enjoy themselves?
They don't have a disabled toilet as such anywhere.
So this is actually such a simple thing as having a disabled washroom, and it's not there. So it's going to take a bit of time, and it's going to take a lot of voices of special parents, educators, and children together to come together and say that we want this, because we are a part of the community as much as anybody else is. So it's in the trend of growing. but it has a long way to go, and hopefully it's going to get better.
Thank you so much, ma'am. You have enlightened us so much. Before we close this, ma'am, what would your message be to News Karnataka?
Firstly, I would want to congratulate News Karnataka on the brilliant initiative. Very few programs and people who really focus on special need parents who need a lot of help, who need a lot of counseling, who need a lot of attention and care, and need to feel accepted, need to know that they are not alone and everybody is together as a group. So hats off to them for having a session and a series of sessions that are helping special need parents, and I would like to thank them from the bottom of my heart. A message to parents, special needs, regular and everybody around is that never try to be the perfect parent, and that's very important for all of us,
Yes.
especially mums. I think we have this, we are born with, the moment we become mothers, we are born with a maternal guilt. We are always trying to be perfect.
And when it comes to special needs parents, they are always like in a guilt.
Overcome with guilt. So that's the first thing. Don't try to be perfect. Don't try to beat yourself and feel guilty. You have been given a mission and a problem at hand because you're a chosen person for some reason. God has chosen you with a larger idea in mind. So feel special about yourself first, before ever thinking that you have done something wrong, or because of you your child has been like that. That is a very common issue I see with mums who have special needs. So don't beat yourself about it, and never try to be perfect. Just try to keep yourself and your special needs child happy and healthy. That should be your motto in life all the time. So never ever try to aim towards perfection, because you're already perfect. You're your child and you have already been created perfectly, and that's how it is, and you're just moving towards a happy and a healthy life.
That's a very beautiful message. Thank you very much, Dr. Joylene. I think parents out there, please don't try to be perfect. Try to be happy. Because if you're happy, your child is happy. That comes from a special parent like me or to other special parents. Please talk about this topic. Puberty is nothing to be scared of, to fear, or to be spoken about behind the doors. Be open about it. Talk to professionals. We have wonderful people like Dr. Joylene Almeida who will be there patiently answering your queries. We have many experts. Talk to parents who are experienced, have gone through that area of parenting. Please talk to each other. Take help of a support group. Be there. Speak out your fears loud. Then only you can be happy. Once you're happy, your children can be happy. So let us continue walking on this special path. We'll be back with another episode. For today, it's thank you everyone.